A pleasant afternoon, everyone. Group 3 here will be discussing to you the types, identification, and characteristics of learners who has difficulty seeing, hearing, and communicating. So this is Maria Antoinette R. Felicia together with my members Ms. Ruth Kuriba, Maris Irish Francachenko, and Zenijoy Cabinega. So okay, we're diving into the lives of the learners who has these types of abilities. Just think of this like we're some kind of detectives trying to uncover some clues and understand better of how these students learn best. They'll try to explore more, find out more about the types of challenges they face, spot their signs, and learn how to create a classroom where everyone can thrive. But first, let me introduce to you the visual impairment. What is visual impairment? So if we say visual impairment, it is a person who has difficulty seeing. So people like this is nagabiin good og assistance from others. Like dili sila makakita, na uban nga dili makakita ang layo, nga blur. Pero nasa uban nga complete blind gyud. Like wala gyud sila makita. So people like this really need some assistance from others. And with the right help, mas makakommunicate pa ni sila og better. So let's move on to the hearing impairment. Hearing impairment means having difficulty hearing. Sure naman jud ko na tanan aware na dani kung unsa ni. So again, this is the disability where a person has difficulty hearing. This can range from a little difficulty to not hearing anything at all. So mahitabo ni siya kung ay part sa imong dunggan or maybe sa both nimo dunggan ay dili mo gana, meaning dili mo jud ka makadungog pagingana. So mao ni siya mga tawo nga napoy uban nga mga tawo nga inborn nga bungol na sa uban nga tungod lang kay na-aksidente sila o na sa uban nga binuhatan nila like paras kay ng kagande nga na siya ka ilang nga bungol tungod kay ginalugit o yawi ang iyang dunggan. So mao ni ang mga tawo nga bungol maglisod og dungog or wala gyud madunggam. And in order to help people like this, of course naa sila mga tools like hearing aids or na sila ilahang own language, mga sign languages para makasabot sa mga tao. And the last one, we have here the difficulty communicating. So as you all know, people with difficulty communicating is one way of saying people with speech impairment. Kabalo man tatanan kung saan yung speech impairment. So, speech impairment, maura ni ang mga tao nga nagalisod og istorya. May uban maganga, may uban maglisod og istorya, may uban dili makasabot diretso like following instructions, directions, or following rules, or answering questions. So, or pwede pa sa ni og maglisod sila makig-istorya sa uban. Nasa uban dili kayo o maglisod sila express sa ilahang mga own thoughts, ilahang mga ideas, maglisod sila una kung sa mga vocabularies nga dapat gamiton para ani. And mao ni atong ginatawag nga expressive language difficulties. Pero with the right help, of course, like speech therapy, learners like this can improve their communication skills. So the rest information will be discussed by our next reporters.
Good day, everyone. Today, I'll be reporting about Chapter 5, Types, Characteristics, and Identification of Learners with Difficulty Seeing, Hearing, and Communicating. And first, I will define the learners with difficulty seeing. So first, let's define some important terms. There's a number of terms that are often used in association with having difficulty seeing. Here's the legal definition of some of these terms, Hayward 2017. So, first is visual acuity. Visual acuity refers to the ability to distinguish forms or discriminate among details. It usually measured by reading letters, numbers, or other symbols from the Snellen eyes chart. When one is said to having vision of 20/20, this means of the distance of 20 feet, one can see what a normal eyes sees at that distance. So, meaning ani, visual acuity is nag-refer si just sa Snellen's eyes chart. So, mo ni ag Snellen eyes chart. tanin nimo makita ang imong kanang vision nimo kung ay kanang asa gajud ay mas makita nimo or dili. So mo ni accident eyes chart. So next is legal blindness. Legal blindness refers to having a visual acuity of 20/200 or less in the better eyes with use of a corrective lens. When one's field of vision is restricted to an area no longer than 20 degrees, one can also consider legally blind. So, meaning ani, legal blindness means having vision of 20/200 or worse in better eyes even with glasses. It also applies a person's field of vision is very narrow or less than degrees wide. So, legally blindness is also means that gamay na gud imo makita bisan og kanang naa na kadani sa kinaunahan 20/20 vision bisan naa kay glasses di gyapon nimo makita nay mga ubang learners na dili na gud makita ag so legally blindness na jud si Janet di na gud si kakita. So next, the third one is partially sighted individuals are those whose visual acuity is a better eyes after correction falls between 20/70 and 20/200. So means partially sighted are those nga naapay gamay nga klaro nga makita between 20/70 to 20/200. So mao ni 20/70 to 20/20 mo na sila. 20/200 or 20/70 kanang 1, 2, 3 mo na sila makita pa gamay maklaro pa nila gamay. So lastly is tunnel vision. So tunnel vision is a condition of having perception of viewing the world through a narrow tube. In this case, central vision may be good, but that peripheral vision is poor in the outer range of the visual field. So, meaning aning tunnel vision is when a person can only see clearly in the center but not on the sides, like looking through a straw. So, ang pananaw ra nimo dalhi tunnel vision is more ra gud siya og kanang circle, di mo makita ang both sides. So, more ra gud siya circle mo makita. So, visual impairment, from the education perspective, that means having impairment of vision that even with corrections adversely affect of learners' educational performance. Totally blind refers to receiving no useful information through sense of vision. In this case, a later use of tactile and auditory sense for all learners. Functional blindness means having a little vision that only learns primarily through the tactile of auditory sense. And now, let's look at the characteristics of learners with difficulty seeing. The following are the characteristics of learners with difficulty seeing. Hayward 2017. First is cognition and language. So in cognition and language, there are usually perform more poorly compared to those on normal vision in terms of cognitive tasks that require comprehension or relating various kinds of information. Second, hard for them to see and understand the relationships among various experiences. Lastly, difficulty when learners abstract concepts, analogy, and idiomatic expressions. So, excuse me. So, cognition and language, learners with visual impairment usually struggle sa cognition o language compared to those with normal sight. Mas lisod para nila na mag-task ng mga nag-required of comprehension or connecting different kinds of information. Naglisod sila ana. So, example, lisod nila makita, masabtan og relationships nga mga experience kung mag-learn sila og abstract concepts, idioms, analogies. So ang teacher jud ani need og adjust methods para maklaro sa ilaha. So, mo ni ang cognition language. Lisod sila sa experiences. So, next is motor development and mobility. First is result to delay in this deficit in motor development. The child may experience painful contact with the environment. Third, vision is also important in telling the distance of objects and direction of movement. Children learns a lot from the feedback and from observing others. So, excuse me. So, in other terms, motor development and mobility, learners with visual impairment usually experience delay in motor development tungod kay dili sila makita o clearly sa ilang environment. So mag-adjust din sila ana. Lisod para nila na mag-estimate sa distance sa object direction of movement. So, sometimes maka-experience sila og painful contact with surroundings like mabangga or masamad. Vision is also very important sa pag-guide kung unsaon paglihok. Mao kung sila ani mag-aspekto sa mobility o mag-independence to sila. Normally, ang mga bata mag-learn og skills of serving others, pero para mga visual impairment, lisod sila kay wala man sila klarong makita. That's why they need special guidance and support sa mag-development sila motor skills. So, anhi sa motor development and mobility, anhi gadjud mag-need mag-adjust ang mga bata. It's because wala sila maklaro. Kailangan pa nila ma-maintain kung ansa gadjud ng lagara, kung asa gadjud na part sa bahay. Kay usually, kung dili nila mailhan, kalingaw din sila masamad o mapiang. So, motong anhi is nagdelay ilang motor development tungod kay was sila maklaro. So, lastly is the social adjustment and interaction. So, may engage in less of plays which could affect their social skills development. Having a visual impairment may increase social isolation and more efforts on the part of the individuals with visual impairment is needed to be able to make friendship. Keeps them from benefiting from role models due to their inability to observe them. Hard for them to see and respond to social signals and others, which reduce opportunity for reciprocal interaction. So, in other terms, social adjustment and interaction, so social aspect. Children with visual impairments often struggle with interaction or friendship. Mag-struggle dyan sila na magpangita og amigo dani. So, they may engage less play will affect their social skills development. Since dili sila makakita og body language or facial expression sa uban, lisod para nila i-recognize or respond sa social signals, which can cause isolation. Kinahanglan pa og extra efforts from parents and teacher para makatabang sila sa keeping friends. Kung kailangan pag parents o kanang teacher na makuan ang bata na dili makakita o dili makadungog para maka-friends sila. So, mao to ang characteristic of learners with difficulty seeing. And those with visual impairment are prone to develop stereotype behavior, such as repetitive body movement, including body rocking, eye piercing and pocking, hand flapping, and head weaving. So, mani sa mga ilhanan na naa kay visual impairment and gitawag ni siya stereotypic behavior. Now, let's proceed to type and causes of visual impairment. The table below shows the various types of causes of visual impairment. Table 6.1, Types and Causes of Visual Impairment. So, there are the conditions, definition, and cause, remarks, and implications. So, first is amblyopia. Amblyopia, definition and causes, reduction in loss of vision of weaker eye from lack of use. Excuse me. Caused by strabismus, unequal refractive errors or opacity of the lens of cornea. The remarks and implication of amblyopia, close work may result in the eyes of fatigue, loss of place, or poor concentration. Setting should favor on functional eyes. Second, astigmatism. The definition and causes is distorted or blurred vision caused by irregularities in the cornea or other surface of the eyes that produce image or retina not equal focus or refractive error. The remarks and implication of astigmatism is loss of accommodation when objects are brought close of the face. Avoid long periods of reading or close tasks that are cause discomfort. Child may complain headache and fluctuating vision. Excuse me. The third is cortical visual impairment or CVI. The definition and cause of CVI is impaired vision caused by damage to a malfunction to a visual cortex or optic nerve, or both. Causes include anoxia, head injury, and infection of the central nervous system. May children with CVI have additional disabilities such as excuse me, such as cerebral palsy, seizure disorder, or intellectual disabilities. The remarks and implication of CVI is visual functioning may fluctuate depending on lighting, condition, and attentions. Usually does not deteriorate. Improvement sometimes occurs over a period of time. Some children with CVI use their peripheral vision. Some are photophobic. Some are attracted to bright light, may fail to blink at threatening motion. Visual image should be simple and presented singly. Excuse me. And lastly is hyperopia. The fourth one is hyperopia or farsighted. The definition and causes is difficulty seeing near object clearly but able to focus on distant object caused by a certain the normal size that prevents light rays from converging on the retina or refractive errors. The remarks and implication of hyperopia is loss of accommodation when objects are brought up close to the face. Avoid long periods of reading or close tasks that cause distance comfort. So the fifth one is muscular degeneration. The definition and causes of muscular degeneration is central areas of retina gradually deteriorates causing loss of clear vision in the center of the visual fields. Common in older adults but fairly rare in children. In remarks of implication, tasks such as reading and writing are difficult. Prescribe low vision, aid and closes circuit TV, provide good illumination and avoid glare. Next is myopia or nearsighted. Distant objects are blurred or not seen at all but near objects are seen clearly, caused by an elongated eye that focuses image in front of the retina or refracted error. The remarks and implication of myopia encourage children to wear prescribed glasses or contact lens. Or near task, child may more comfortable working without glasses and bringing work close to face. Next is nystagmus. Nystagmus. The definition and causes is rapid involuntary back and forth movement of the eyes, which makes it difficult to focus on object when the two eyes cannot focus simultaneously. Simultaneously, the brain avoids double image by suppressing the visual input of the one eye. The weaker eye, usually one turn inward and outward outward, can actually last inability to see, can occur on its own but usually associated with others' visual impairment. So remarks and implication is close task for extended period can lead fatigue. Some children turns off tilt head in obtain the best focus and do not criticize this. Criticize this. Lastly is the strabismus. The definition and causes in inability to focus on the same object with both eyes because of an inward and outward deviation of one or both eyes, caused by muscles imbalance and secondary to other visual impairment. The remarks and implication is classroom setting should favor students. Stronger eyes, some students may use one eye for distance tasks that one other's eyes for near tasks. Frequent rest periods may be needed during close works, may be needed more time to adjust the unfamiliar visual tasks. Hayward 2017. So that's all the topic of types and causes of visual impairment. And now, let's go to identifying learners with difficulty seeing. So, wala na ni siya dyan ako gisuwat it because taas si Jab at ako din dyan gisummarize. Ako na lang din si Jang basahon. So, learners with visual impairment may show signs through eyes appearance, redness, tearings, turning of the eye styles, and behaviors, headache, blurred vision, squinting, frequent eyes rubbing, and fatigue. They may struggle with reading, copying, eye-hand coordination, letters, and word reversals, and visual perception, often making errors or avoiding visual tasks. Teachers and parents should recognize these indicators and seek medical help. The activity asks students to watch The Miracle Worker about Helen Keller and Anne Sullivan, then reflect on Helen's struggles, Anne's guidance, and listen to the future teacher. So that's all of my topic. Thank you for listening, and the next reporter will be Miss Coriba.
So now let's tackle about the deaf and hard of hearing learners. So we have here the definition. The deaf community are those deaf and hard of hearing individuals who share a common language, common experiences, and values and a common way of interacting with each other and with hearing people. So I have here two examples of deaf community. The first one is the National Association of the Deaf. It advocates for deaf rights, accessibility, and the promotion of American Sign Language. The second one is the Philippine Federation of the Deaf. It is a national organization that unites deaf Filipinos and promotes Filipino Sign Language. In IDEA 2004, the term hearing impairment means an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance, but that is not included under the definition of deafness in this section. In other words, hearing impairment is a partial or total loss of hearing caused by various factors including aging, loud noise exposure, genetics, infections, and other ear conditions. There are two main categories of hearing impairment, the deafness and hard of hearing. The first one is deafness. Deafness means a hearing impairment that is so severe that the child is impaired in processing a linguistic information through hearing with or without amplification, and that adversely affects a child's educational performance. Ang second one is hard of hearing. Hard of hearing learners Hard of hearing learners with the use of hearing aid has residual hearing sufficient to enable successful processing of linguistic information. So, ang hard of hearing are those learners nga naapay nabilin nga kaya nga makadungog pa sila kung gamitan sila og hearing aid. Unya, kung igo ang ilahang residual hearing, mas dali nila masabtan ang mga information nga ipaabot sa ilaha. Pero kung kulang, bisan pa og naas nag-use sila og hearing aid, maglisod lang gyapon sila og process sa uban nga information. So, let's proceed to the types of and causes. There are commonly three types of hearing loss. The first one is the conductive hearing impairment. The second one is the sensory neural hearing impairment. And the last one is the mixed hearing impairment. So the first one is the conductive hearing impairment. Conductive hearing impairment is a condition when there is a disruption in the transmission of sound in the middle or the outer ear. So common causes aning conductive hearing impairment is the earwax blockage, ear infection, fluid in the middle ear, perforated eardrums, or physical damage to the outer or middle ear structures. The second one is the sensory neural hearing impairment. This characterized by issues within the inner ear or with the connection to the brain. Ang cause ani include aging, exposure to loud noise, infection, certain medication, head injuries, and genetic factors. So sa last nga type of hearing loss is the mixed hearing impairment. It refers to a condition when both types of hearing impairments, the conductive and the sensory neural, are present simultaneously. It causes ear infection in some with age-related hearing loss or noise-induced damage alongside middle ear fluid buildup. So, classifications of hearing loss can also be described as unilateral or bilateral. The first one is the unilateral hearing loss. It describes as the hearing loss on one side of the ear, either left or right. So from the word uni, so it means usa. So sa bilateral means both ear has hearing loss. Hearing loss can also be classified according to the onset in which it was acquired: congenital, acquired at birth, and acquired present after birth. Another is that hearing loss could also be prelingual, acquired before the development of spoken language, or postlingual, acquired after learning the spoken language. So let's proceed. Causes of congenital hearing loss. Genetics plays a crucial role in acquiring congenital hearing loss. This can also result from non-genetic causes like prenatal infections. Example, cytomegalovirus or rubella. Complications during birth, low birth weight, or maternal substance using pregnancy. So ang sunod is causes of acquired hearing loss. The first one is the otitis media. So ang otitis media, it is an inflammation or infection of the middle ear, commonly known as middle ear infection. It results from fluid buildup behind the eardrum, often caused by viral or bacterial infections linked to colds or allergies. Symptoms include ear pain, fever, pulling at the ear, especially in children, and difficulty sleeping. The second one is the acute otitis media, or the AOM. It is a rapid onset infection that results in inflammation, erythema, and accumulation of fluid in the ear, and it is located beneath the eardrum. This may result in fever, ear discomfort, and temporary hearing loss. The third causes of acquired hearing loss is the otitis media with effusion, or the OME. It is commonly referred to as a glue ear. It is the accumulation of fluid in the middle ear without any accompanying infection. This can result in impaired hearing and challenges in maintaining balance. The fourth one is the chronic suppurative otitis media, the CSOM. It is a persistent infection of the middle ear that can cause harm to the eardrum and the small bones in the middle ear. This can result in permanent hearing impairment. The last one is the meningitis. It is an infection and swelling called inflammation of the fluid and membranes around the brain and spinal cord. So, ang tawag sa membrane sa meningitis is the meninges. Excessive exposure to noise also leads to the degradation of one's audition. Sounds that are amplified to 120 dB to 150 dB are already destructive to a typical person's ears. So here are some of the characteristics that are common among those hearing impairment. So the characteristics of learners with hearing impairment vary widely depending on the case of their hearing loss. There are those learners who find amplification of sounds useful for their residual hearing. So the first one is may have difficulty with speech, reading, and writing due to the close relationship of language and hearing. Second one is the fail or may take time to respond quickly with spoken or verbal instructions. Next is may use hearing aids and or with amplification systems to enhance oral communication. May prefer to use visuals or American or Filipino Sign Language as their mode of communication. Their expressive language may vary based on their experience and development. Next one is have a large deficit in terms of academic abilities, especially reading and language skills. So in terms of social skills, deaf learners find it hard to find someone who can make conversations, which sometimes lead to isolation. So, so we have here the educational approaches. The educational approaches. The first one is the technology and support. Technology and support. Some learners with hearing impairment, especially those who are hard of hearing, use hearing assistive technology to support their audition and be able to understand the information that they get from different settings. There are several hearing assistive technologies that teachers must be aware of and follow and allow students to use to enhance the learning experience of learners with hearing impairment. So the second one is the hearing aid. The most common type of HAT is hearing aid. The HAT means hearing assistive technology. So the common type of HAT is hearing aid, an ear worn or behind the ear electronic gadget of compact size. It amplifies certain sounds to enhance the listening experience, communication, and active engagement of individuals with hearing impairments in their daily routines. People who wear hearing aids can hear better in both serene and loud environments. This device comes in different shapes and sizes that has three parts: the microphone, amplifier, and speaker. The third one is the cochlear implants. A cochlear implant is a complex technological device that enhances hearing. The assistive listening devices, or the ALS, are personal amplifiers designed to enhance sound levels during in-person talks and small group conversations. These boxes are approximately the dimension of a deck of cards and are equipped with both a microphone and a listening wave. Both the speaker and the listener utilize the same equipment. Augmentative and alternative. Augmentative and alternative communication. It is a devices offer alternative means of communications for those who are unable to use spoken language due to profound hearing loss or speech problems. Commonly used synonymously with the term speech generating device, or the SGD, augmentative and alternative communication, or the AAC, devices typically take the shape of a tablet or laptop. Next is the alerting devices. Alerting, alerting devices offer visual or tactile cues to enhance safety and awareness for those with hearing impairments when significant sounds or alerts occur. Commonly referred to as signalers or notification devices, these gadgets typically employ flashing lights and or vibrations to notify individuals of different noises in their surroundings. Speech-to-text translation. Computer software or applications that use speech-to-text translation aids the learner with HI or the hearing impairment to visually access class discussions and increase their understanding about the lesson. Next is the audio-video transcriptions. Transcriptions are an indispensable component of assistive technology, providing access to multimedia content and information that may have been difficult to understand. Today's technology, such as televisions, are equipped with a device that will enable users to have captions anywhere of their screens. So we have here the teaching approaches. The oral approach, total communication, simultaneous, bicultural or bilingual approach, and the accommodation. So let us first know what is oral approach. Oral approach to deaf education includes the use of sign language, speech reading, or total communication. Instead, it emphasizes the development of resistive or the hearing and expressive spoken language skills. So the second one is the total communication or the simultaneous communication. Total communication encompasses both an educational philosophy and a method of communication. So it employs diverse modes of communication to teach students with hearing impairment in the English language. The bicultural bilingual approach. So, while there are various versions of bicultural bilingual approach, majority of them consist of three key elements. The first one is the American Sign Language. So, ang American Sign Language, it is regarded as a principal language, whereas English is regarded as the subordinate language. Second one is the individuals who are hearing impaired by play a significant part in the advancement of the program and its educational framework. The third one is the program incorporates education on deaf culture. So, we have here the example of the sign language. The next one is the accommodation. Consider the following accommodations for use in instructions with students who has hearing impairment. First one, when giving verbal instructions to students, make sure that we are facing them as others may try to lip read what you are saying. The second one, it would be beneficial for them if the teacher would write or post the instructions on the board. Next, teachers must speak clearly and use simple words with or without exaggeration. Next, development a signal system for the class. Example, the use of sign language when going to the restroom or raising two fingers for those who would like to ask a question. Next, voice modulation will be useful for them, but the use of audio amplification devices for the class instruction would be even better. Next, the adaptation of visual cues. Picture-supported text, written notes, outlines, and diagrams helps the students to visualize and comprehend the topic. Next is the pair learners with hearing impairment with hearing learners for peer tutoring. Next is use captioned versions of streamed video or film or provide a printed copy of the material. The last one is write important information on the bulletin boards and keep the reminders readable and direct. So let's proceed to the placement options. The first one is the residential schools. Residential schools. One of the placement options for deaf learners is by attending residential schools. School for the deaf can be an effective institution for them to develop their communication and language skills while learning together with his or deaf classmates. Residential schools also offer specialized instructions and programs that would fit on the unique learning style and need for the deaf students. The last one is the inclusive classroom. It is important that the school must hire an interpreter for a class with deaf learners to accommodate the lesson for better understanding. So while it is undeniable that there are some barriers for the deaf children when enrolled in a regular class, the benefit of socializing and exposure to hearing individuals remains critical. So it is important that the schools must hire an interpreter for a class with deaf learners para ma-accommodate nila ang lesson para makasabot ang bata og naadyoy better understanding ang mga deaf learners. And that is all. Thank you.